Hi, this is Dr. Bruce Kanehl in Jacksonville, Florida, and I have a topic that will be of much interest to just about anyone today. If you look at our logo on the front page here, you'll see our apple, which we've worked with the apple with the bite for many, many years. But in recent years, we've gotten very interested in sleep. So we've added a little moon and some stars to our logo. So, yes, I treat sleep apnea. I make appliances to treat sleep apnea, and they work great. I sleep with one myself. But for many people, they do not need help with an appliance. They need to have sleep hygiene, which is guidelines for better sleep. So today, I would like to go over a number of guidelines that can help you have a more restful and healthy sleep. So, number one, these can improve sleep and reduce the need for sleep-inducing medications if you follow the guidelines. Get the right amount of sleep for you. Well, what's the right amount of sleep? For the average person, it's between 7 and 9 hours. Some people can live on 6 hours. Some people need more. But on the average, try to get the same amount of sleep every night, between 7 and 9 hours. And try to sleep through the night without wake-ups. Yeah, as you get older, you may have to go to the bathroom a little bit, but go to the bathroom, get right back in bed. But don't be interrupted by other things. And keep a regularly scheduled time for your sleep. Try to go to bed at the same time every night. Try to wake up at the same time. You'll do a lot better. You notice we just had a time change. The clock moved forward an hour, and we lost an hour's of sleep. You see how difficult that is if you just lose an hour of sleep in that time change there. When you travel, go across country for 3 hours, it really messes your system up for a few days. So try to go to sleep at the same time every night. But don't go to bed unless you're sleepy. If you go to bed and you just toss and turn and try counting sheep, then that isn't going to work. Get up, go read a book, take it easy, and then go to sleep when you're tired. For most people, naps are not beneficial, at least lengthy naps. Short 20-minute naps can be helpful. Einstein, the story goes, took a 20-minute nap every day. He was pretty smart and was pretty successful. The reason you don't want to take a nap much more than 20 minutes is you start to use up some of your REM sleep. And REM sleep should be done, that's the healthy part of your sleep, should be performed during your nighttime. And if you use it up during the day, you're going to be short of REM sleep at night, and that's not healthy for you. You know, sometimes you take a nap and you wake up and you're groggy and you don't know where you are, and it takes a while to really wake up. You used up some REM sleep, and guess what? It's probably going to be hard for you to fall asleep that next night. In the long run, you're going to be more tired. So find the right bed, the right mattress, the right pillows, the right position to sleep. All very important. If you're not comfortable, try a new mattress, try a new pillow. Keep the room cool. Those people who have trouble falling asleep would be wise just to drop the temperature a degree or two. Cool room allows you to get a better night's sleep. Along the same lines is exercise late in the afternoon or early evening. What that does is you warm up during that period. Later, your temperature starts to drop and you can sleep better. So it affects the body's temperature exercising. Make sure it's dark. Today's day and age with technology, we got computers and TVs and lights coming out of all these things, and the room is not as dark as it used to be. Turn them off, or put your computers in another room and your TV in another room. So that room is for sleeping and not for other things. Food, drinks, snacks, don't take them before you go to bed. They're just going to stimulate you and not allow you to have a good night's sleep. And alcohol is the number one sedative people think to fall asleep. And it does help you fall asleep. But guess what? A few hours later, you start waking up and you don't get the good quality of sleep. So in the long run, alcohol is not healthy at all. So if you're going to have alcohol, have it at least 4 hours before you go to sleep at night. Avoid chronic use of sleep medicines. You can get addicted to these sleep medicines. If you're going to take them for about 3 weeks and then try to get off of them. If you smoke or chew, that nicotine is not healthy for you. It's a stimulant. And you will fall asleep maybe, but then during the night, the stimulant will wreck your sleep pattern and you won't have as sound a sleep as you deserve. So find your bedtime ritual. You know, as a child, you'll often brush your teeth, say your prayers, have a book read to you. Nice little ritual. We don't do that as adults, but it would be good. It may be as simple as brushing your teeth, reading a chapter in a book, and going to bed. But try to find a ritual which is relaxing, and that'll help you fall asleep quicker and have a better quality sleep. Now, if you're a snorer, you may have problems beyond what sleep hygiene will help for you. So get yourself checked by a physician. Have a sleep test done, either it's a home sleep test or an overnight sleep test, to see if you have obstructive sleep apnea. Because this is more serious. It can even be life-threatening. So make sure you take care of yourself. Start with sleep hygiene. It may be all you need. If you are more interested in what I just talked about, go to our website at www.kanehldental.com. There is a whole area of obstructive sleep apnea, has in writing what we just talked about. If you feel like you need to be treated for obstructive sleep apnea, give us a call at area code 904-731-2162. Tell whoever answers the phone that you heard about us in this video, and we'll have a free consultation, and we can lead you from there on how to treat it. So have a wonderful day, and we hope to see you soon.